So today I am here to discuss about the visual pathway defect. This is a very common question in Mrcpch part 1, part 2 and also in clinical part. So to understand the visual field defect, we must understand that in our retina there are two kinds of fibers, that are temporal fibers and nasal fibers. So the light ray which falls on the retina from the temporal fiber, they represent the nasal field of vision, and light rays that falls on the retina from the nasal side, like medial side, they represent the temporal field of vision, because light rays falls straight. If you see my cursor, light rays fall on a straight manner. Okay, so the nasal fiber represent temporal field of vision and temporal fiber represent nasal field of vision. So when due to any reason, due to raised intracranial pressure or due to some tumor or surgery, there is a loss of optic nerve of the right eye, so the right eye will be completely blind, because the temporal fiber and nasal fiber both are cut down or both are damaged. So the right eye will be completely blind, but the left eye will be normal, because the visual pathway of left side is intact. Now what happens when there is a central part of the chiasma is damaged, optic chiasma? So optic chiasma has two parts, central part and peripheral part. We can see that the temporal fibers of the right eye is not crossing, that are directly going to the optic tract, but the nasal fibers of the right eye, they are crossing. Similarly, nasal fibers of the left eye, they are crossing in the chiasma, but the temporal fibers of the left eye are uncrossed. So in a nutshell, temporal fibers of both the eye does not cross, and nasal fibers of both the eye are crossed in the optic chiasma central part, and so lesion in optic chiasma central part will loss of both sided temporal field vision loss. So this name is bitemporal hemianopia, because both sided nasal fiber cut down and they represent the temporal field of vision. Suppose due to any cause like compression of the third ventricle, then the compression will create pressure on the lateral portion of the chiasma. Then there will be binasal hemianopia, the opposite condition. This is very rare, because bilateral third ventricle enlargement is very rare. Bilateral lateral ventricle enlargement is very rare. So here, in very rare situation, the lateral part of the optic chiasma can be damaged bilaterally, so there will be binasal hemianopia. But in the lesion like craniopharyngioma or any tumor in the pituitary gland, the central portion of the optic chiasma will be damaged and there will be bitemporal hemianopia. So a patient will look like this picture. A patient can see the nasal field of vision, but the temporal field of vision will be lost. So this is called bitemporal hemianopia optic chiasma lesion. Now what happens in number 3? Number 3 is called optic tract. So if optic tract is cut down on right side or damaged, then what happens? The temporal fiber of the right side will be damaged and nasal fiber of the left side will be damaged. Why? Because nasal fiber of the left side is crossed. So when there is a right optic tract is damaged, number 3, the nasal field will be lost in right side, but temporal field will be lost in left side. Why? Because the nasal field of vision is supplied by temporal fibers. So the temporal fibers are cut down in right eye, so the nasal field will be lost in right eye. Similarly, nasal field of vision in left eye will be intact. Why? Because the temporal fibers of the left eye are intact. Okay. Similarly, temporal fibers of the left eye will be, temporal field of vision in the left eye will be impaired. Why? Because the nasal fibers that are crossed from left eye, that is injured. Okay, so this is called homonymous hemianopia. This is not similar with the bitemporal. Bitemporal is asymmetrical. They are both opposite sided. Okay, and number 3, homonymous, they are same side. Okay, the field of vision is lost on nasal field of the right eye and temporal field of the left eye. Okay. Now, if the lesion is in the geniculate body, that is number 4. Geniculate body is a nucleus in the thalamus. So, if the lesion is in the geniculate body, number 4, then what will happen? The similar things will happen as number 3. There will be homonymous hemianopia. Nasal field of right eye and temporal field of left eye will be lost. But from the geniculate body, there is optic radiation. And if you see the fibers from lateral geniculate body to optic radiation, the fibers are twisting upside down. So what happens when the fibers are twisted upside down? There is, if the temporal fibers are cut, temporal fibers represent the lower fibers. The lesion will be superior quadrantenopia. Superior quadrantenopia. That means 1/4 of the right eye nasal field of vision will be lost, and 1/4 of the left eye nasal field of vision loss. So this condition is due to superior quadrantenopia. This is due to temporal field of vision loss. Temporal field is a part of optic radiation. Now, what happens when the parietal lobe is injured? Parietal radiation is injured, because we know optic radiation has two parts. Optic radiation has two parts, parietal radiation and temporal radiation. So temporal radiation will cause superior quadrantenopia, and parietal lesion will cause inferior quadrantenopia. Why? Because the fibers of the parietal lobe are upper fibers, and they cut down and cause inferior quadrantenopia. So this is our pathway up to optic radiation, parietal lobe and temporal lobe. Now what happens when the occipital lobe is injured? Okay, when the full occipital lobe is injured, there will be features like homonymous hemianopia, because whole of the right sided fibers are coming into the occipital lobe visual field. So there will be homonymous hemianopia with macular sparring. Macula is the central part of the visual field, and that space will be intact, so patient can see in the central part. So this is called macular sparring. So lesion in the lateral geniculate body, lesion in the optic tract, and lesion in the visual field. In these three conditions, there will be bilateral homonymous hemianopia. Homonymous hemianopia means right eye will be loss of vision of nasal field, and left eye loss of vision of temporal field. This is called homonymous hemianopia. Now what do you mean by congruous and incongruous? Congruous when there is a similar fibers are cut down, same kind of lesion. Incongruous means when the lesion is not similar. I mean, some fibers are more in one eye and some fibers are less in another eye, are cut down. This is called incongruous. So this is the right superior quadrantenopia. You can see the right sided temporal field is lost. That means here which side is lesion here? This is definitely temporal field of temporal radiation is lost because it is superior quadrantenopia, and this is of course homonymous hemianopia. So here the right eye temporal field is lost. Temporal field represent the nasal fibers of the left eye. So here the lesion is in the left sided parietal, left sided temporal radiation, because temporal fibers represent upper part of the optic radiation. So it is left temporal optic radiation damage. Okay, so up to this much I hope is clear for you. So this is the complete picture. If you see, this is the complete picture of the optic pathway lesion. So you can see that lesion of the optic nerve will be causing blindness here in the left eye. Lesion in the proximal part, this is number 2, proximal part of the optic chiasma. So one eye will be completely blind, another eye will be half blind. Central part of the chiasma lesion, there will be bitemporal hemianopia. Lateral part of the chiasma lesion, there will be binasal hemianopia, number 4. Lesion in the optic tract, this is homonymous hemianopia, left sided homonymous hemianopia. Lesion in the geniculate body, lateral geniculate body, same lesion, homonymous hemianopia. Now lesion in the optic radiation, number 7, optic radiation in temporal lobe. So lesion in the optic radiation will cause, temporal lobe lesion will cause superior quadrantenopia on the left side, and lesion in the optic radiation in the parietal lobe, inferior quadrantenopia on the left side. Now superior quadrantenopia, another name is pie in the sky, and inferior quadrantenopia, another name is pie on the floor. Okay. Now lesion in the optic radiation in the parietal lobe, we know this is pie on the floor, inferior quadrantenopia. Lesion in the optic radiation, if full optic radiation is cut down, similarly it will be like it is similar as lesion in the optic tract, lesion in the geniculate body. So this is homonymous hemianopia. And if the lesion is in the full occipital lobe, there is homonymous hemianopia with macular sparring, because macula is the central part that is usually not involved in any tumor or hemorrhage. So this is macular sparring. But when only the macula is damaged, this is only macular involvement. I hope this is clear for you, and if you like this video, please share and also subscribe the channel. Thank you very much.